Good afternoon, everyone. Today, we'd like to welcome Dr. Paul Bunnell, and he'd be speaking to us in regards to what it's like to be a physician, what his role has, or how has his role taken a different path and throughout the years, any highs and lows that he's seen, any education he's obtained or certifications he's acquired, as well as how has COVID-19 impacted his daily work routine. We'd like to welcome you all, ask that you mute all lines, and please put any questions or comments in the chat box. Thank you again, Dr. Bunnell, for joining us.
Oh, it's a pleasure, Rachel, and I'll be glad to begin whenever your group is ready.
Yes, sir, you may begin.
Okay. My name is Dr. Paul Bunnell, and I'm a internal medicine doctor, a physician, and live in a small community in South Texas and near Victoria, Port Lavaca, Texas. My title at this time, I'm what is called a hospitalist physician. I work at the hospital taking care of patients that are admitted to the hospital either directly from doctors' offices or that come to the emergency room. I went to Austin College, which is in Sherman, Texas. It's a small liberal arts college, and then went to medical school in Houston at the University of Texas Medical School branch. There's several branches of the University of Texas medical schools. And then I left Texas to North Carolina to do my residency at Wake Forest University in internal medicine. I was there for 3 years as what's called a resident. That's where you do your training in clinic and hospital. And then I stayed for an additional year as what's called the chief resident, where you help in organizing the residency, the education of interns and residents as they leave their college and leave their medical schools and go to receive their training. I chose medicine because I always had an interest in science, particularly in regards to how how organs work, how our heart works. The cardiovascular system would be an example, the pulmonary system, and applying the science that you learn in high school in biology and chemistry to taking to how it can be used in a positive way to help people who are ill, why they're ill, and how to receive the training to how to treat them based on the knowledge of that science. The entry level, again, to the healthcare professional as a physician is first going to college and completing your basic sciences. And that would be a series of courses that are required in order to apply to medical school and I should say to sit for the entrance examination for medical school. Many kids are put the idea of being a doctor aside because they look at the number of years that are involved for training. But what you don't understand until you've chosen this pathway is once you've left college and started medical school, you're now on a journey of education and learning about medicine, the care of patients in a variety of different ways, manners. And so your education is starting, but you will continue to be in that mode throughout your career. Even now, I'm still involved with continuing education, and so I would encourage you, if you look at medicine as a field, once you're in there, you're kind of a member of the club, and that club is always growing. It just depends on what level you're in. You have to go through each level to progress, but you're in medicine after the first 4 years. You're a doctor, but you're a doctor without much experience, and then you move on to be getting additional training in the residency. And I'll come back to that with an example at the end of this talk. What are my daily activities like? Well, I get up in the morning and I go to the hospital. And first thing I do is look through the records of the patients that are already in the hospital, first in the intensive care unit. Then I go up to the medical surgery floor, look in on patients that are there for medical problems, like, say, a pneumonia or difficult to control blood pressure. And then I will check in on the patients that have had surgery. The surgeons do the surgery, but the medical doctors take care of the patients before and after surgery. So I then in evaluating a problem, let's say someone having quite a bit of pain in their abdomen that's had a CAT scan, or someone who's had a seizure, who has an MRI scan of the brain. I go down to radiology and review those records, the films. Now it's all on computer with the radiologist, where I can give them information about the patient, ask questions, and review the films directly. After I've done that, there may be patients that need diagnostic studies done for, say someone that's having severe pain in the upper abdomen and maybe had nausea, a lot of vomiting, maybe even a little blood in that vomiting, to be worried about an ulcer. We will do diagnostic studies, such as taking them to the endoscopy lab, and the anesthetist will put them to sleep, and I'll put a light-guided instrument down into their stomach while they're sleeping to evaluate the lining of the stomach as to what is the culprit behind their pain. So those are the things that I do. And the part that I enjoy the most is visiting with the patients, going over the results, answering the family's questions, because in today's world, many of the family members live out of our town. We call and contact those family members in another city to answer their questions. With COVID, the COVID-19, we've not allowed visitors in the hospital. That was a state mandate. So it became even more important to contact someone who was sick, to contact their spouse and tell them what was going on, as an example, to keep them in the loop as to what was going on with their loved ones. People get appropriately, they get very tense when a loved one is in the hospital, and your job is to communicate what is going on and to reassure that their family member's doing well, or if they're not doing well and need to be transferred to a larger hospital, to explain why and make those arrangements. Academic knowledge, in terms of what the training is, it starts in college with you learning biochemistry and microbiology and unfortunately math, which I didn't really care for a lot, but I would also tell you that in medicine today, medical schools are looking for well-rounded individuals. They don't want someone who's just book smart. They want individuals that know how to relate to people. What kind of things did they do in the summer? Did they take any courses that were outside their area of study? Like, example, my wife was an English major. She was not a science major, but she is a physician as well. And she completed those courses that qualified her to sit for the medical school exams and apply to medical school. So again, volunteer activities. They just want to make sure that you're going to be able to talk to patients and their families in a way that they can understand. There's plenty of smart people out there to go to medical school. But it doesn't require really a great deal of intelligence. It requires just being able to put the time in studying and learning all the information. When I talked about the COVID and how it has affected my practice, COVID has had a major effect on individuals that work in hospitals and in clinics. For myself, we have been individuals that might present to our emergency room with the big three symptoms of fever, not so much of a cough, but shortness of breath. They may have a bit of a cough, but it's not very productive of any phlegm. And the big concern is if they're having to work hard to breathe, if they're short of breath, and if their oxygen level, when you put that little gadget on their finger, if that is low. In COVID, that level can often be low, and the patient really isn't as short as breath as if they might appear. When you're evaluating these patients, you're in fully dressed with protective equipment. It takes time to put that on. It's not entirely comfortable. You get hot wearing it. You're wearing double gloves, and you evaluate the patient. Because the COVID testing has not been readily available, we often would have to admit patients with high suspicion to the hospital, to an isolation room, and then wait literally 2 to 3 days to find out if they really had COVID. Many times you could be suspicious based on certain factors, but imagine that 3 days you don't know if they're COVID, but each time you go in to see them, you've got to put on all of that equipment to go in. And so you have to be very careful about that too, because the virus gets on that equipment, that gown and such. So you have to take that off in a way that you don't get the COVID on your hands or on your clothing. I talked a bit about how the area of medicine, and I'll also say the area of nursing, is it's a practice of continual education. We knew very little about COVID. We knew that there were coronaviruses, and they typically caused mild upper respiratory infections. But the COVID-19 is a virus of a much more greater virulence, meaning in terms of the severity of illness that it creates. And so we've had to learn as we go, reading everything we can get our eyes on. And fortunately, with technology, with computers, and the urgency of spreading that knowledge, even from China, getting that knowledge from doctors in China, and then in Seattle and New York City before COVID ever got down to Texas, it allowed us to have a better understanding of the virus and what kind of problems we should be ready for. So with that, I'd be happy to answer any questions, but want to just come back to the idea that if you've ever thought about the field of medicine, whether in the role of a doctor or a nurse or an anesthetist, that would be a nurse that studies to know how to do anesthesia and put people to sleep for surgery or for the procedures I spoke about, don't be put off by the lengthy duration of study. The real question is, do you like people? Do you enjoy talking to patients? Do you feel comfortable that you could learn how to reassure patients and explain what is going on with them, a good communicator? And do you like to learn? Because I love to learn, with technology, there's an infinite amount of sources for information for me to read about when I have a particular patient come in to brush up my knowledge on a given subject matter. So once you've received a nursing degree or a medical degree as a doctor, that's who you are, and the learning will just go on forever and ever and ever. Initially, it's going to be more at being under the guidance of a physician when you're an intern and resident, and then as you get further along, you turn around and now you're teaching the next group of interns and residents that have been to medical school. You're also involved with interaction with the nurses and teaching them about given patients from the doctor's perspective, while they also get instruction from the nursing educators. So it's a process. You never stop. Once you've done this, you're a doctor forever. I don't think I'll really have plans on retiring. There's always going to be a role for a doctor as long as they still have their wits about them, which I hope to keep for a long time. I may not be doing it full time, but there's always going to be a service that I can provide to patients in some manner. And the same things go for nurses. And so with that, I'll finish and be glad to take any direct questions.
Dr. Bunnell, are you able to see the ones in the chat box? I could read them out to you.
No, I can click them on.
Yes, sir.
Okay. Are licensing exams and certificates transferable from state to state? It really varies with the state. Louisiana, for example, and Oklahoma and New Mexico, there's about over state lines they provide acceptance. What you'll find is that typically states that are short on doctors are going to do anything they can do to get doctors. So as long as if you've, for example, in Texas, if you have licensing and they're short on primary care doctors, you're not going to have any problem. But if there's a specific relationship where you're going to go to school in Texas, but you really want to end up in another state, I would check on that with their board of medical examiners. What classes do you suggest a high school student take? As a high school student, I would recommend just working very hard in the studies of science, of taking them very seriously, because it's a building block. Microbiology at a high school level, then at a college level, and then at a medical school level. And let's say that you, as a medical student, you find that you really love that subject and you find yourself headed into becoming a specialist in infectious disease and a researcher with microbiology. Well, then there's just more and more and more of that learning until finally you're the teacher. You're the person who's researching, say, take the individuals that are researching on the COVID virus and how to have an accurate test and working on this vaccine. These are really very bright people, and that's the track they went on. Does your hospital have volunteer opportunities? That's a great question, because we do, and all hospitals do. It's a good opportunity to work in the hospital as a volunteer with the hospital volunteers. It gives you a chance to visit with the physicians and the nurses and to see all the different departments within the hospital as you provide taking specimens to that, or helping taking a patient out to their car after they've had an outpatient study. What is my point of view on residency out of country? Well, it obviously there are residency programs out of the country that are excellent. Um, Areas like Australia, England, France. I think what would make more sense, typically you don't see US students going out of country for their residency, but they might go out of country for a fellowship. Let's say, what is a fellowship? A fellowship would be, let's say that you went to medical school and you decided you wanted to go into infectious disease. So you do a residency in infectious disease study and then decide you want additional study at a hospital out of country to get that experience. Or it's very flexible. You could take a year off and go do a senior year or an internship in a residency out of country and then come back and complete your training so you could become board certified in that area of study. If we go back to a minute to internal medicine. Internal medicine is adult medicine. We don't take care of children. We don't take care of, the cutoff is roughly 16 years of age. But if you know of someone that, say, is a cardiologist or a gastroenterologist or an endocrinologist or a hematologist or a lung doctor, a pulmonologist, all of those individuals are internal medicine doctors, and they've done a specialty. After they did their residency, they did a specialty just in that area. And that's where you have to choose. Since knew I was going to be moving to a small town, we don't need specialists in a town the size of Port Lavaca. We need people of more general physicians. They're just not a high enough volume of patients for a specialist in our town. So, but going back to the question about doing residency out of country, I think it'd be a lot more clear to you as to whether that would be a good opportunity and where, after first getting through medical school and then looking forward towards residency. But it's going to be hard to beat the training in the US. I mean, you can probably find equivalent training, but it's going to be hard to beat that training. But I certainly had folks who went out of country to do fellowships, like becoming a specialist in infectious disease would be an example. Can you give students and young adults a word of advice for this career choice? Well, don't be put off by the number of years. If you wanted to add up the years of college, medical school, residency, say you decide to do a fellowship to be a specialist, like a cardiologist, you would add up those years and you say, that's ridiculous. But what you don't understand, once you've gone through your first 2 years of medical school, you are then on the floor taking care of patients. You're still in a learning role, but you're not in a classroom sitting behind a desk anymore. You might have courses that you take for an hour once a day, but your focus is being out there, seeing patients, rubbing elbows with residents and these fellows I mentioned, and the full-time physicians that are on staff. So those years fly by, number one, but number two, don't have this idea that you're going to be boxed behind a desk. That's just not the way it's going to be. You're going to be actively dealing with patients and the individuals that are giving you direction as you go and examine patients and take a history from them and make a recommendation on treatment. Do I recommend Doctors Without Borders or Peace Corps? I think anybody who, we'll talk about Peace Corps first. Peace Corps is a great program for someone if you wanted to take a gap year between college and wanted to go to medical school and got accepted with the idea that I want to take a year in Peace Corps to, say, go to a country where they speak Spanish so I can become fluent with Spanish. that would be, if, in the United States, that would be a great thing to make medicine much more enjoyable to practice if you were bilingual with Spanish. Doctors Without Borders, well, they're looking for doctors. That's a big commitment. I mean, they go for several months. For internists to do Doctors Without Borders, you would basically be making a commitment of maybe 3 months. For myself, that would be hard to find someone to take my place for 3 months. But there are certainly folks that are in positions that might be, for example, affiliated with a medical school where they can take a sabbatical and do 3 or 6 months with Doctors Without Borders. But they're looking for folks that are fully trained physicians, that you're going to get out there in the field and you're going to need to be able to evaluate patients and make decisions right on the spot. The Peace Corps, that's a great place just to, if your mind is cluttered and you want to make sure your decision on whatever you're going to do is the right decision, either between college and going to residency, medical school and going to residency, or between college and going to medical school, it can be a great experience, give you a lot of insight into conditions outside the United States, and help develop a lot of leadership skills, communication skills, a lot of confidence, self-confidence in yourself. One of my sons was in Peace Corps, and those are the things that it gave to him. So that I speak not from personal experience, but from his experience. Rachel, I'm clicking more and I don't see any more questions. Have my explanations, do they need additional, were they confusing, or
I think that was good. I think maybe there was one. It states, what does your schedule look like in a normal week? I believe as a hospitalist, what does that consist of?
Okay, well, I start taking call. My shifts begin on Sunday evening at 7 o'clock. And at that time, I'm available to the emergency room doctor to call me if someone has come to the emergency room that needs to be evaluated or admitted. And sometimes the emergency room doctors don't know quite what to do with a given patient. And I don't mean in terms of treatment, it's more of being socially stuck in terms of, say, an elderly person who has no family in town, has fallen, she's alert and awake, but she's injured herself or a bad cut, and we just are going to admit her so we can take care of her until she's well enough to go home and arrange home health and other sources for her. So going back to the question, Sunday night through the night, and then I work Monday, Tuesday, Wednesday, and Thursday until 7 o'clock in the evening, and then I'm off. So I go to the hospital in the morning at 7, and when do I come home? Well, like most doctors, I come home when all the work is done. Usually that's around 5 o'clock in the afternoon, sometimes later. If there's some late admissions, it might be as late as 8, but most commonly I leave around 5 to 6.
There was one other question, and it states, if a student is diagnosed with a disability, are there modifications that could be implemented to better assist them with becoming a physician?
If a student has a disability,
Yes, sir.
and
Any impairments, whether it be visual or mobility, it doesn't state what the disability is, but if they are diagnosed, what could be implemented to assist them?
if they were interested in medicine,
Based on the way it's written, yes, sir.
okay. Well, I think in that case, they would certainly make accommodations for that. I can't imagine someone who might have um, a disability who would be a better role model to their, or as they go through the medical practice, to be a great role model for younger younger doctors coming into medical school than someone who might be able to focus with a with a disability, but there were certainly be accommodations made, whether it be mobility. A person who I've always admired a great deal is a cardiologist in Victoria who is now teaching in a medical school in San Antonio. He's always been a great teacher. And I think that was always his true love. So he was in practice in Victoria for a number of years, but chose to go to teaching at one of the University of Texas medical schools. And he has a rather severe stutter. And when I look at him, he kind of serves as my shining light that, if he can get through medical school and the communication necessary with interviewing patients and in the surgery suite and during his cardiology procedures like heart catheterizations, I just admire that. And obviously, when you talk to him, you just have to be very patient, but it's not a problem because everything he says, he's so knowledgeable and you learn so much from him. So the answer would be yes.
There's another question here in the panel. It says, along with this career, is the stress level usually high, or are there situations more calming?
The stress level can be high, and I think that is something that that medicine continues to work with, tries to manage. For example, residents in residency, the days of people taking call every third night, that meant going to work on a day, working all day, staying up most of the night, taking care of the patients that of the residents who were off that night and taking admissions, and then working the entire next day, or have come to an end, where they where now the residents have a fixed number of hours that they can work before they need to be relieved to go home. But yes, it can be very stressful. I think we all handle stress differently. I think some areas of medicine are more stressful than others. I don't want to be dishonest with you and say that there has been concern about the suicide rate of physicians over the last several years. So that's a great question, and so it is of concern.
Dr. Bunnell, how do you personally handle a healthy work-life balance?
Well, I guess primarily through, I think I'm blessed that living in a smaller community, there really isn't any long commute to and from work. It's a bit more personable because the number of people in our facility, the number of workers, it's less. You know everyone perhaps a little bit better simply because of sheer volume. I try to exercise regularly. That can be hard sometimes. If I get a lot of telephone calls at night and I'm sleep deprived, I'm not feeling it's very wise to go out jogging when you not had enough sleep. So it's not perfect. We do have a YMCA in Port Lavaca that I've been very involved with, and I try to get over there at least 3 times a week, but probably don't exercise as much as I should.
What encouragement do you have for those who may want to work in a bigger city versus a smaller town? What are the positive attributes that a small town physician has versus a large inner city physician?
Well, I think both provide positives, but in just a different manner. I think it's a great question. I'll explain it as best I can. It'd be hard to, if you were in a larger city, you've got a lot of specialists around, and so if you're a specialist, then that's what you do. I mean, you would, let's say that you're an infectious disease specialist or a pulmonologist. That's going to be your area of expertise and what you do. And you're going to have doctors like myself referring people to you, or family practitioners referring their patients to you. In a smaller community without specialists, you're forced to maybe uh, maintain your knowledge base a little bit broader. Um, Most basic pulmonary problems, I feel comfortable managing only because I have to do it all the time. It's all about experience. So in a smaller community, one of the things I enjoy is that I have to continue to upon my knowledge and training of different subspecialties, cardiology. Uh, um, a good example, if I have someone come get admitted with chest pain, and it's and they get it, they come to the emergency room and their EKG shows some subtle changes, but their blood tests are negative. Their chest pain has some characteristics of possibly being pain related to the heart, but other symptoms that are not. In a big city, you would just consult the cardiologist and let him or her come and sort the wheat from the chaff and do an evaluation. In Port Lavaca, the general internist would go ahead and do diagnostic studying. That might be an exercise treadmill test. That might be an exercise treadmill test where we also combine it with nuclear medicine imaging of the blood flow to the heart. Or it might, let's say it's a patient who's 75 years old and's got arthritis of the knees that can't get on a treadmill test. We have ways of creating stress for the heart with medication that stimulates the heart to beat more rapidly and more forcefully, just like happens when we all exercise. So again, if you're in a big city and you're a cardiologist, you'd be taking care of that patient. If you're in Port Lavaca, Texas, then it's going to fall to the general internist. And then if that test is positive, then we adjust their medications, or we say, you've got a problem, but it's not a severe problem. We're going to start you on medications. We're going to make you an appointment with the cardiologist so he or she can look over all these things, see if they feel anything else needs to be done. So that's the difference between the two. And each are good ways to practice medicine. I think for a hospitalist, and I enjoy being able to continue doing things that in a larger city, there would be a specialist to do that. One of the areas that I'm in charge of, as an example, is our cardiopulmonary rehabilitation program. So patients that have had heart attacks, or have had bypass surgery, or have had a stent placed, or we have had 2 patients with heart transplants. After their medical problems have been taken care of and they've recovered for 4 weeks or so, they come back to Port Lavaca. We have a program that lasts for 6 weeks, where they come 3 times a week and it's educational, learning about diet. They go through an exercise program that gradually increases their exercise capacity for physical conditioning. And the same thing for people who might have lung disease, whether it be asthma or what's called COPD, which is a blend of emphysema and chronic bronchitis. So those are things in a small town that I enjoy doing, that there would be a specialist to do that in the in the big city. And it's not, and that's fine. I mean, it's not hard to be the director of that if you're just willing to put in the time, being acquainted with the exercise, the evaluation, uh, and stay up to date in that subject matter.
One last question we have here. It states, what is the similarities and differences between a physician and a physician's assistant?
A physician's assistant is what we call a mid-level provider. There are two types of mid-level providers, physician's assistants and nurse practitioners. And because of the shortages in primary care physicians, I mean, and let me just tell you quickly what primary care is. Primary care would be considered internal medicine, family practice, pediatrics, obstetrics and gynecology, and then I suppose general surgery, but not so much. So let's just leave it with the big three, or big four: family practice, internal medicine. Remember, internal medicine, we talked about all the subspecialists that come off it. Pediatrics, same thing. Pediatrics will have subspecialists come off. There'll be a pediatric pulmonologist, a pediatric cardiologist, pediatric surgeons, and then OB-GYN. So nurse practitioners and physician assistants have completed the nursing route, are registered nurses who do additional 2 years of study and are able to work directly with doctors. And the same thing with physician's assistants, except their training path is not through nursing school. And so they operate or function under they have to have an assigned physician that they work with. Now, in some states, they are giving nurse practitioners independence to practice independent of physicians. I don't strongly recommend that. I have a nurse practitioner that I work with on our hospitalist service, and she is a new nurse practitioner. She just finished her education, and I think she would be the first to tell you that she has a lot to learn just through the experience of taking care of patients with she and I working together. And then she's been working with me now for about 8 months. And I suppose after a few years, I mean, keep in mind, I did a 4-year residency. It takes a while to learn all this stuff. And that's after going to medical school. So I think that's their role. I think it should be the role of working with physicians, to have a physician that when they come into the tough patient, that they can say, can I review this patient with you? So that you shoulder the burden together. And I would be a little uncomfortable with nurse practitioners being forced into a position of having a patient that they're not comfortable with, but not having someone to review that with. Heck, I often have to pull one of my colleagues aside and present a physician, and the two of us work it out, or call a specialist. So that's what a nurse practitioner is. Physician's assistants, they go through a different type of training, but they go through a physician assistant school. But in order to apply for a physician's assistant school, they have to have certain undergraduate courses that they've taken.
Thank you so much, Dr. Bunnell. Does anyone else on the call have any questions or anything they'd like to add at this moment? With no further questions, I want to appreciate you all for connecting. Thank you, Dr. Bunnell, for the great information. We appreciate your time. Please, everyone, stay safe, stay healthy, and you all have a good afternoon.
Thank you, Raquel.